Now we're trying to look at another skeletal system issue. So this one is what is known as the diffuse idiopathic skeletal hyperostosis. Diffuse idiopathic skeletal hyperostosis. All right. So what is it? And let's quickly look at this. So it's a non-inflammatory condition of the spine and what? Entheses. Entheses is all those sites that the tendons and ligaments usually what? Attached to the bone, you know. So it's characterized by abnormal calcification and what? Ossification. So it's sometimes called what? The Forestier's disease. So it's a systemic disorder, okay, with flowing ossification along the spine and the what? Extraspinal what? Okay, there's also extraspinal manifestations. So you see what? Enthesopathy. Okay. So instead of you having a smooth ligament running across, there's ossification, there's calcification. You know. So let's look at it. So key feature of flowing calcification and ossification of the anterior longitudinal ligament of the spine, typically over at least 4 contiguous vertebrae. It's non-inflammatory. Okay. So pathophysiology, you have enthesopathy, so the excess bone formation at where the ligament and tendons are attaching. Ligament is getting ossified. The metabolic association is associated with diabetes mellitus, obesity, hyperinsulinemia, and metabolic syndrome. So clinical features is what? Spine stiffness, reduced spinal mobility, back pains. Then extraspinal symptoms is what? Enthesopathy, you know, heel spurs and all of those beautiful things. Then dysphagia, difficulties in swallowing. So age group usually affects older adults that are more than 50 years. It's more common in men. Okay. So you diagnose it using what? The radiographic criteria, which is known as what? The Resnick and the Niwayama. Okay. So you see that you have the issue on at least more than 4 vertebrae. Okay. Absence of sacroiliac joint erosion or effusion. Okay, and in ankylosing spondylitis, you usually see, you know, that. So on imaging, you see candle wax flowing ossification. CT scans and MRI is actually a better visualization of ossification and compression effects. So use analgesics, use NSAIDs for pain, physiotherapy to maintain mobility, weight reduction and metabolic control. All right, so that's what we got.